If you're a man between 40 and 65, feeling like your energy isn't what it used to be, this might surprise you. You don't need pills, injections, or surgery to revive your potency, because nature designed something far simpler. Every man has a hidden point in his body, a small cluster of nerves and vessels that, when gently stimulated for just 1 minute a day, can unlock the body's natural flow of vitality. I've seen it restore confidence, intimacy, and health. I'm Dr. Vera Sterling, a urologist, and today, I'll tell you the truth most men never hear from their doctors. As a urologist, I've spent decades studying the intricate connection between a man's physical health, hormonal balance, and emotional well-being. Yet what still surprises me is how little men truly understand their own bodies, especially when it comes to potency, energy, and performance. Many arrive in my office defeated, ashamed, and convinced that age has stolen something essential from them. But aging isn't the enemy. Stagnation is. In my early years of practice, I began to notice a pattern. Men who sat for long hours, carried extra abdominal weight, or had poor circulation often complained of the same cluster of issues: loss of drive, weaker erections, fatigue, and even urinary troubles. Their blood tests would often show mild hormonal imbalances. But what struck me was something more mechanical than chemical, something rooted in circulation and nerve health. That's when I turned my focus toward an often overlooked structure in male anatomy: the perineal zone. It's the area between the scrotum and the anus, a region rich in blood vessels, nerves, and muscular fibers that form the foundation of pelvic function. In traditional medicine, this area has been referred to as the root of vitality. It's not mystical. It's anatomical. When this area becomes tense, inflamed, or understimulated, it can restrict blood flow to the pelvic organs, including the prostate and penis, leading to a gradual decline in potency. I remember one of my earliest patients, a 58-year-old man named Arthur. He was fit for his age, but confessed that intimacy had become a source of stress rather than joy. After ruling out underlying disease, I suggested something unconventional: targeted perineal massage. 1 minute a day, I told him, to awaken what's already there. Within weeks, he returned astonished. His energy had improved, his confidence was back, and his partner noticed the change even more than he did. The science behind this is straightforward. The perineum houses the bulbocavernosus and ischiocavernosus muscles, key players in erectile rigidity and ejaculation. When blood circulation is sluggish, these muscles weaken. Gentle daily stimulation through massage improves oxygenation, activates parasympathetic nerve pathways, and even reduces tension in the pelvic floor, a critical yet neglected aspect of male health. Many men assume that erectile difficulties are solely about testosterone, but in reality, local circulation is often the root cause. When blood flow improves, hormones are utilized more efficiently, and nerve sensitivity is restored. The result? A renewed sense of vitality that feels natural, not forced. As I continued my research, I developed a simple 1-minute technique designed for men over 40. It requires no equipment, no medication, only awareness and consistency. The key is gentle pressure, not force. The massage stimulates the perineal tissues, triggering a cascade of microcirculatory responses that improve the oxygen supply to the entire pelvic area. Over time, this can reduce inflammation in the prostate, enhance erectile firmness, and restore confidence in one's body. But there's a deeper benefit: emotional reconnection. Many of my patients say they feel alive again, not just physically, but emotionally. They regain that quiet sense of masculinity that doesn't depend on performance, but on inner balance. Yet, I always remind them, this is not a miracle. It's physiology. The body heals when circulation flows freely and tension is released. Modern life, with its constant sitting and stress, blocks that flow. What we're doing is teaching the body to remember what it once knew, how to regenerate. In the next part, I'll guide you through the exact steps I teach my patients: how to locate the precise area, the correct pressure to apply, and how to combine it with breathing to maximize the results. Because once you understand how to awaken this hidden point, you'll see why 1 minute a day can truly transform a man's vitality. When I introduced this method to my patients, I wanted it to be something they could safely practice at home, discreetly, naturally, and without discomfort. As a urologist, I've always believed that restoring a man's vitality shouldn't depend solely on prescriptions. It should begin with understanding the body's own intelligence. So let's begin with the foundation: awareness. Before any physical touch, a man must learn to reconnect with his pelvic region, an area most ignore until problems arise. Sit comfortably in a relaxed position, knees slightly apart. Take a few slow, deep breaths. As you inhale, feel your abdomen rise. As you exhale, let it soften. This breathing alone begins to relax the pelvic floor, reducing the tightness that restricts blood flow. Next comes localization. The spot we're focusing on lies midway between the scrotum and the anus, the perineum. If you gently place 2 or 3 fingers there, you'll feel a slightly firm area beneath the skin. It's neither bone nor muscle alone, but a connective bridge housing vital nerves and vessels. This is the hidden switch I often refer to when I talk to my patients. The point that, when activated, restores the natural rhythm of circulation and nerve signaling. The massage itself should be firm yet comfortable. I advise using the fingertips or the knuckle of the index finger to apply gentle circular motions. Do this for 1 minute. No longer is needed. The goal is not pressure but stimulation. Think of it as waking up an area that's been asleep. During this time, continue to breathe deeply, imagining blood and warmth spreading through the pelvis. Some men notice subtle tingling or warmth afterward. Others feel relaxed or energized. These are positive signs, indicators that dormant circulation pathways are being reawakened. Over the following weeks, many report stronger morning erections, better control during intimacy, and reduced discomfort during urination. I've also seen improvements in prostate health markers, something we monitor closely in clinical settings. But beyond the physical transformation, what moves me most is the change in self-perception. Many men, after years of frustration, rediscover confidence they thought was gone forever. I recall a patient named Daniel, 63 years old, who told me after 3 weeks of practice, "I feel connected to my body again." That single sentence captured what modern medicine often overlooks: that healing is not only biological, it's emotional. Now, for safety. I always remind my patients that if there is significant pain, swelling, or recent surgery in the area, they should consult their urologist before beginning. This is not a replacement for medical treatment, but a complement, one that harnesses the body's own power to restore balance. To enhance the effect, I often suggest combining this 1-minute massage with simple pelvic floor exercises, like gentle contractions of the muscles used to stop urination. When performed mindfully, this strengthens the bulbocavernosus and surrounding muscles, ensuring that blood remains within the penile chambers longer, promoting firmer erections naturally. Equally important is overall lifestyle, hydration, balanced diet, maintaining a healthy weight, and reducing alcohol or nicotine intake. The perineal massage is not magic in isolation. It's a catalyst. It enhances what the rest of your habits support. In clinical follow-ups, I've observed men who integrate this practice experience sustained improvements not just in potency, but also in energy levels and mood. Their partners often comment on subtle changes, deeper intimacy, renewed affection, and a sense of youthfulness that goes beyond the physical. As a urologist, my greatest satisfaction comes from seeing men reclaim their health without fear or shame. Too often, discussions about potency are clouded by embarrassment. But what we're truly talking about is circulation, muscle tone, and nerve balance, all fundamental aspects of health. If there's one message I want every man between 40 and 65 to take away, it's this: you are not broken. Your body hasn't forgotten how to perform. It's simply waiting for you to reactivate what time and tension have silenced. Start today. 1 minute, gentle focus, consistent effort. Over time, you'll not only notice changes in your performance, but also in your confidence, your posture, even your outlook on aging. This is not a miracle cure. It's a reminder of how remarkably responsive your body still is. As I often tell my patients, you don't grow old when your years increase. You grow old when your circulation stops moving. I'm Dr. Vera Sterling, and I hope this message helps you rediscover what's been within you all along: your strength, your vitality, and your power to heal.